first start our exercise protocol with deep breathing exercises. Breathe in, out, in, out, in, out, in, out. Relax. Now we start with facial exercises. Frown. 1, 2, 3. Relax. Normally we do it 10 repetitions. Now eyebrows up. 1, 2, 3. Relax. Now lowering of your cheeks. 1, 2, 3. Relax. Smile. 1, 2, 3. Relax. Lips out. 1, 2, 3. Relax. We start the exercise protocol starting with deep breathing exercises. Hands on your ribs. Deep breathe in. Breathe out. Deep breathe in. Out. In. Out. In. Out. Relax. After this, we start with the self-stretching exercises. First, we'll be doing self-stretching of quadriceps. This is the starting position. You just have to stretch your leg to the maximum. Stretch behind. Hold it for 10 seconds. And then relax. The similar thing you do it with the other leg. Hold it for 10 seconds and relax. Repeat this just thrice. Now we move on to dorsal spine stretching. Toes up and just slide both your hands up to the wall.
Knees straight.
Just stretch your hand as much as you can. You'll feel stretch in your lower back as well as the mid back. Just hold for 10 seconds and then come down. Down. Relax. This also just 3 repetitions. Now we start with the floor exercises. The starting position is to go on all fours, that is your hands and legs. Now slowly try to sit on your heels, taking your buttocks down. Hold for 10 seconds and then come back to your starting position. Do this 3 times. After this, take a rest, pause for 2 minutes in just sitting position.
रुको राशि रुको down.
After this, what is called is a Superman position. Taking alternate hand up. Take your right hand up. Along with it, you take a left leg up. And just try to stretch as much as you can. And hold for 10 seconds. Relax. Similarly, with the other hand, that is your left hand goes with your right leg. Try to keep your hand with the shoulder level. Relax. Relax. Your knees should be straight. Relax. After this, we move on to plank exercise, which is basically done to strengthen your core as well as your shoulder and leg muscles.
No, this will be done for 2 minutes. Start.
Yeah.
Stopwatch.
Start. Your elbow should be at the level of the shoulders. One minute done.
कितना हुआ?
Okay.
1 minute 25 seconds.
फोर्टी पर रुकता हूँ.
Stop. 1 minute 40 seconds. Next, we move on to push-up exercises. In between all the floor exercises, you need to take break of minimum 2 to 3 minutes. After this, we'll start with push-ups. The lower leg is kept at an elevation so that it becomes easier for him to do it. Push-up exercise mainly targets your core, chest as well as your shoulder muscles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, go down, 16, 17, 18, 19, 20, 22, 23, 24, 25, relax.
Yeah. Now I'll be sleeping on the bed. Herein you will be able to see that due to ankylosing, the fusion which has happened in my neck and part of my upper spine. Because of that, when I lie on the bed on my back, my head doesn't touch down to the surface of the bed. But having said so, by using an extra pillow, we can still do the exercises for our core, for your pelvic muscles, hip muscles, thighs and other stretches, which will be now seen to you. See, this is the gap. This is the gap. गैप दिसते ना नीट.
हो.
आता लावू शकतो.
Now, what we are doing are bed exercises. We'll start with a basic warm up of moving your ankle up and down, which is to be done 10 times simultaneously. Relax. After this, bend your knee alternately, down, left, down. Relax. After this, take a break of a minute and then start with stationary cycling. Bend both your knees. Raise your hand a little and start. Keep your breathing normal. This exercise also helps in strengthening your core muscles. Relax. What we do here is 2 sets of 30 counts each. After this, we start with pelvic rotations. Start. Try to move your neck in the opposite direction as much as you can. This also has to be done 10 times. Relax. Again, take a break of a minute or two. And then bend both your knees and try to lift your back up. Down. This helps in strengthening your back muscles. Down. This also has to be repeated 10 times. Relax.
Hi. Now this is the typical another issue with ankylosing spondylitis patients is our ribcage pain, either on the left or on the right. Now herein, what I am facing for the past 2 years is ribcage pain on my left side. So once I lie down and when I get up, it starts, a massive spasm comes here, this side, complete, extends up till this side, makes it difficult for me to breathe, makes it difficult for me to immediately stand up also. Now after 2-3 months of exercises, the intensity of this spasm has come down, but as you can see, I am still a little bit out of breath because this entire portion is completely jammed. Now herein, this will settle down after some time. What you can do here is also use hot water fermentation and do some deep breathing. I'll do some deep breathing right now to help me in this. Now this is one stretch also which can help you. Yes, something goes like this. Hold till count of 10. Now one important thing, friends. Being an ankylosing patient, the way I have done these exercises here are not and may not be the perfect way to do your own exercises. Each patient has got different stiffness issues, different joint problems. So the way every patient will do his own exercises will be completely different. So this is the way I can manage it. Maybe you can manage it much better than me. But remember one thing, I have learnt all of this from a professional physiotherapist for the past 3 years. And right now also here in this shoot right now, she is there here in this shoot and she is guiding the entire proceedings that are here. Thanks. Hello friends, my name is Gautam Dandekar and this video I am making here to share with you my story of ankylosing spondylitis. To start, I can start with something like this, that exactly 2 years back, my ankylosing spondylitis really flared up in a very big way. I was not in a position to sit properly in a chair, to get up properly from a chair, to lie down on a bed properly, to get up from the bed properly. I could not walk around in my own house. For say year 2012 and 2013, I was literally stuck in my house. I could not move around. I could not even sit and travel in a taxi. It was that bad. And I was not finding any solutions to help myself. But at the end of 2013, I luckily discovered the zero starch diet. And one look at it, I felt like most of you, when you say zero starch, don't eat this thing, don't eat that, don't eat wheat, bread, rice, potatoes, beans, dals, all that stuff. So I had a thought, how will I able to do it? But then I figured out that it is quite easy, because the choice of the food is restricted to only 2-3 items. So basically you have to eat only this much and you cannot eat the balance of the stuff. So with full faith in what I had read about the leaky gut, the intestinal problems and the zero starch diet effect on our leaky gut issues, I started it. And touch wood, fingers crossed. Slowly over a period of 4 to 6 weeks, 7 weeks, 8 weeks, I felt those tremendous improvements in myself. My chronic debilitating pain started vanishing away from my body, and I started walking again. I was much more comfortable. It was like 90% of the chronic pain had vanished. I had pain, I still do have some pain, but all these things are quite manageable. And so for the past 2 years I've been doing the diet, and then then I formed the Ankylosing Spondylitis India Facebook group. Today we have grown to a large number. On the group we are now 1450 plus patients, and many of our group patients who are doing the diet, they have also benefited. Now the main, of course, this is not a medical treatment per se. This is my experience sharing with you. So please do not take this as a professional medical advice. This is a patient's experience sharing about how I am, and how I was able to manage and control my ankylosing spondylitis, so that I could come up till this level. Now following you'll also see certain physiotherapy exercises which I am doing currently. So from the level from where I was and from where to what I can do today physically, there's a world of a difference. And I am damn sure that if I continue on the same track, I will be able to be even more better in my posture, in my movements, in my pain in the next 6 to 8 months time. My major issue is with my neck. My neck is fused, my upper spine is fused, and when I was having issues like what I said 2 years back, I'll tell you where all it was also paining me. I had chest pain here, I had my both shoulder pains, I had my elbow pains, I had wrist pain, I had severe spasms coming right from my spine, entire spine. They used to come from the spine and the ribs and up here. My stomach used to be just like a stone. My pelvic hip joints here had started paining. My knees started paining, ankles started paining. My feet used to be swollen. I used to have severe spasms on my thighs, on my calf muscles. A simple thing like when we try to gargle, we take water in our hand and we take it to the lips. So even if it hit my chin, I could not take simple hit like this. That was the sensitivity for my neck. So from all these big issues, for the past 2 years, these things have gone. I have got very simple, now pains like the ribcage pain is there, and some pain in the back. My right shoulder has been severely affected by ankylosing spondylitis, so I'm recovering here on the right shoulder pretty much better now. So as lots of friends in the group, you have requested that I should put up a video. Here I am trying to put up a video. This is an amateur attempt. This is not a professional attempt. So please forgive the mistakes whichever might happen, and please share your stories also on the Facebook group. That is how our community will grow and benefit. And in the next video, what I'm planning is we will make an extensive video about food. We'll be going straight into the kitchen. We'll be preparing certain dishes. We'll be showing you lots of stuff which can be eaten very easily, and you can have a fulfilling lunch and fulfilling dinner. Your tummy will be full, which is healthy, nutritious, anti-inflammatory, alkaline, rich with proteins and healthy fats. So the next video will be focused on the eating part of the treatment, what we do in the zero starch diet or the ultra low starch diet, as I said. So thanks a lot and hope you enjoy. Thanks.